Well, just moments ago, more schools have announced changes. We've learned that Iredell Statesville schools just extended spring break to March the 20th. Today, Atrium Health lined up 10 experts to answer questions, and Channel 9's Mark Becker was there. Mark?
Yeah, we have heard a lot about those people who are highest at risk, the elderly and the people with underlying and previous medical conditions. Haven't really heard much, though, about the impact of coronavirus on children, which is exactly why this afternoon a panel of doctors and administrators from Levine Children's Hospital addressed some of those questions and concerns, from pregnancy right through the teen years, and the discussion of how to talk to your children about their fears and concerns as well. And here are some of the takeaways from that discussion. First of all, pregnant women and newborns should be considered at higher risk. But there is some positive news. They say there's no evidence that the coronavirus is transmitted in utero from a mother to her unborn child. More good news. If infected, children tend to bounce back more quickly, as they often do from common colds and the like. And they say to reduce your child's anxiety, limit their access to social media. That will help. And Dr. Arthur Spell, who's a pediatrician on the panel, says it's important to teach your children how to protect themselves.
I think it's hard to keep children from touching their faces. It's honestly hard to keep adults from touching their faces as well. But I think as parents, we just have to remind them gently that it's important right now that we really try hard to keep our hands out of our face and to wash our hands frequently.
Now that, of course, advice we've been hearing from the beginning here, and I suspect we will continue to hear it because, frankly, the doctors, the experts we heard here today say that really is job one. That is the best way to prevent it from spreading. It's a message we've heard, but it will not get old because it's the most important message. Back to you all.
All right, thank you, Mark.